I'm one of the surgeons at the Reno Vein Clinic, where we specialize in treatment of varicose and spider veins in all areas. Well, there are a number of things that work against women in pregnancy, and it starts very early. In the later stages, the growing uterus in the pelvis compresses the pelvic veins and creates a lot of back pressure into the leg veins, causing the distension and the ankle swelling and things that people normally see. That can resolve to a great extent once the delivery occurs. But what people don't know is that very early in pregnancy there are hormones secreted that encourage dilation of blood vessels, including the veins. Those are in preparation for the baby growing and want to enrich the blood supply. But if you have a tendency towards vein distension or varicose veins, that tendency will start to be exacerbated even in the first trimester. If there's someone with, say, a genetic tendency towards clotting or a very strong history of family problems with varicose veins or what they call pulmonary emboli, or clots going to the lungs, then pregnancy becomes a significant risk and has to be monitored closely. There's only a couple of things that anybody can do with prevention, and especially during the pregnancy, where you don't want to take any medicines that aren't necessary and you don't want to do anything that threatens the viability of the baby. The two things are exercise regularly, and just walking is the best exercise for your veins, especially your leg veins. The other is the stockings that are available, maternity compression stockings, should be started early in the pregnancy because they magnify the effect of the walking, the muscle actions, and massage and compress the veins and thereby resist the distension that goes on as the pregnancy progresses. Most of the women who've ever had a baby talk about the heaviness to the legs, the ankle swelling in many of them. They want to put their legs up frequently, especially in the later parts of the pregnancy. And that's a natural reaction to the kinds of pressures that are accumulating. So generally they'll feel things, especially in the latter trimester. About 60 to 70% of the vein distension and the veins that become prominent during pregnancy will regress after the delivery. You don't want to really evaluate them for at least 3 months after delivery because that regression will be ongoing. The ones that do not, 30–40%, won't go away again, can be treated as any other varicose veins, and it requires an evaluation with ultrasound to see whether what you see is all there is or whether there are some underlying veins that were damaged and might need more definitive treatment. In terms of type of treatment, it can range from sclerotherapy, which is injections into the veins, occasionally laser for spider veins or very tiny ones. Bigger veins often require an intervention called radiofrequency closure. What that entails is putting a catheter inside the larger vein and heating it from the inside. That causes it to shrivel and collapse and essentially takes it out of the circulation without having to take it out of your body, which is what old-fashioned stripping did. The result is the same. Pressures are taken away, the veins resolve on their own, and there's a significant improvement. Like anybody else, the results will vary according to what type of things get done. Sclerotherapy can vary in how quickly you see results from a couple of weeks to 6 or 7 weeks.